Today we are going to talk about alpha-gal syndrome, even though this is probably unfamiliar to most of us, but it is common, unrecognized disease process. Alpha-gal syndrome is a serious, potentially life-threatening allergy condition that can occur after tick bite. It's named after the molecule called galactose alpha-1,3 galactose that is found in most mammals. The symptoms occur after people eat red meat or exposed to other products made from mammals. So stay with me, it is not just related to red meat alone. It has lots of implications in South Asia and also the Eastern cultures. So AGS or alpha-gal syndrome, also known as red meat allergy or tick bite meat allergy. The time course of alpha-gal story goes like this. In 2000, there are two groups reported a case of meat allergy after tick bites. In an African village, they found IgE to cat allergens but did not relate to any symptoms. The most compelling evidence came between 2005 to 2008 when they first introduced cetuximab is a monoclonal antibody against colorectal cancer. What they found was there were severe reaction to cetuximab. They were common in Tennessee, North Carolina, Arkansas, Missouri, and Virginia. And those severe reactions happened 3 to 6 hours after eating beef. Further investigation found out alpha-gal was identified, that epitope was identified in cetuximab. The other important discovery, the IgE against alpha-gal was already present in those individuals who had severe allergic reactions. This is the area the severe allergic reactions were identified. This is southern and eastern United States. 2009, the first time there were 24 cases of delayed anaphylaxis to red meat was published. During the same time, there were multiple case reports from Sydney and other parts of the continent, other parts of the world. In the United States, the tick that carries the alpha-gal antigen was called Lone Star tick, otherwise called Amblyomma americana. The Lone Star tick being seen here is found in southeastern United States. It's found in woodlands, forests, and even mowed lawns. They actively hunt their prey. They are attracted by cues like carbon dioxide, heat, and movement. It's not only associated with alpha-gal and also associated with ehrlichiosis, heartland viral disease, southern tick-associated rash illness, Bourbon virus disease, and tularemia. As you can see here, it's not just from United States, it's also reported in Brazil, South Africa, Zimbabwe, Europe, Turkey, Australia, and in Asian countries, South Korea, Japan, and Sri Lanka. The tick that carries this alpha-gal is different in each and every geographical area. In the United States called Amblyomma americanum, and other places they carry different names. 25% of the population lives in South Asian region, but only there are 4 cases have been reported, that too from Sri Lanka, University of Colombo. So there's lots of things can be done in rest of the area. It's not that it's not there, it's not explored or diagnosed properly. As we said earlier, the first identified or first reported case 2000, but that time they did not know it's an alpha-gal syndrome. Between 2010 to 2022, there are 100,000 cases of presumed alpha-gal syndrome identified in the United States. But one should remember, the IgE against alpha-gal moiety was available commercially only in 2015. So the real numbers would be probably much higher than 100,000. And the other reason is many clinicians are not aware of this alpha-gal syndrome. The survey conducted by CDC, United States CDC, found 42% of healthcare providers unaware of the condition. Another 35% lacked confidence in diagnosing or treating these patients. So, the vast majority of the healthcare providers do not even know the alpha-gal syndrome and also how to treat. In South Asia, as I said, where there are 25% of the population, Earth's population lives, only there are 4 papers. There two came from University of Colombo, Sri Lanka. I'm going to discuss that paper later. How does pathogenesis happens? The alpha-gal allergen identified as alpha-gal syndrome is an oligosaccharide found in the cells and tissues of all mammalian meats. The sensitization to alpha-gal is thought to occur through parasitic infections, most commonly tick bites. The 80% of the patients bitten by ticks have a higher alpha-gal IgE levels. United States, 90% of the tick bites happen in southern United States caused by Lone Star tick. The other ticks are also being implicated, meaning the D tick in United States, cayenne tick in Central America and Brazil, Asian longhorn tick in Asia, primarily in South Korea and Japan. So when the tick bite the human being, it introduces alpha-gal into the skin. The dendritic cells and that process that alpha-gal antigen, then process through the lymph nodes and produce plasma cell and plasmablasts or IgE. Then alpha-gal IgE armed basal cell and mast cells. So glycolipid hypothesis. The IgE-mediated activation of mast cells after mammalian meat is the activation happens after the meat is being consumed. After meat consumption, alpha-gal molecules reach bloodstream after 4 hours. This is very different from any kind of oral allergies, like allergies consumed by mouth. It happens usually within an hour. But this particular syndrome takes a couple of hours. The reason being, I'm going to explain the next slide. Then the alpha-gal molecules bind to the specific IgE antibodies on the surface of the basophils and mast cells that release allergic mediators, stimulate sensory nerves, inducing visceral pain, and activate excessive mucus secretion by mucus glands. There are 4 steps involved. 1, ingestion of the meat or mammalian products. The intestinal emulsification, absorption, and chylomicron packaging happens in the intestine. Then, through the lymphatics, the chylomicrons go into the thoracic duct, finally into the bloodstream. When the alpha-gal molecules get into the bloodstream, that activates the allergic reaction by binding with IgE antibodies on the surface of basophils and mast cells. So alpha-gal is associated with the tick bites. In the United States, the name of the tick is called Lone Star tick. The most reported cases in the United States in South, East, and Central states. In other countries, other ticks have been implicated. All age groups can develop alpha-gal syndrome, but most cases have been reported in adults in the Western countries. The paper published from Sri Lanka shows more in children. There's another paper published in 27. It tells you how many health providers are unaware of the alpha-gal syndrome. There are 107 presumed alpha-gal syndrome. Out of 107, 97 patients were not diagnosed with encounters with emergency department and also with the other specialists. So if you do not heard about this disease, don't feel bad because vast majority do not know. Even among 10, those are presumed alpha-gal, they did not know the alpha-gal exactly. At least one nurse found, hey, there is something wrong. You need to go and get tested. There was one patient in emergency department was identified, but not by a doc, by a paramedic. 7 by primary care provider, 1 by dermatologist. This paper goes on and saying the vast majority of the diagnosis was done by the patient themselves by reading from Google, Reader's Digest, and other non-medical books. So still underdiagnosed, but it is very common disease. The alpha-gal syndrome kind of varies. It can be isolated abdominal pain or nausea, emesis, heartburn, or it can be urticaria or pruritus, or it can cause severe things like angioedema, shortness of breath, coughing, wheezing, like asthma-like symptoms, and frank anaphylaxis. The many individuals who are sensitized, especially with the low IgE levels, are asymptomatic. So it's a wide spectrum of clinical manifestations that can occur in alpha-gal syndrome. So the reaction can be hives, itchy rash, nausea, vomiting, severe abdominal pain, heartburn, indigestion, and diarrhea, sometimes constipation. Symptom usually occurs in 3 to 8 hours after exposure to alpha-gal, but it can also happen immediately. Almost 10% of the patients develops symptoms within an hour. So you have to be cognizant. You cannot be dismissive because the symptoms happens within an hour. So what are the factors associated with increased severity? When the patient had a higher alpha-gal serum IgE or higher serum IgE level when compared to total IgE ratio, then the manifestations will be severe. And also, when the mammalian meat is eaten along with alcohol, non-steroidal anti-inflammatory drugs, apparently it increases absorption, thus presenting more antigen to already sensitized individuals. Exercise before eating again exacerbate the symptoms. So alpha-gal can be severe or life-threatening. So seek immediate emergency care if you're having severe allergic reaction. These are the food items that had a high amount of alpha-gal: beef, pork, lamb, venison, rabbit, or other meat from mammals. Especially certain organ meats have a higher concentration of alpha-gal than others, such as liver, kidneys, intestines, and sweetbreads. It's often seen in Rocky Mountain disease, the disease area, and also in the prairie oysters. Food products that contain milk or milk products may also contain alpha-gal. That's where the South Asia plays a role. However, many patients with the AGS, alpha-gal, can't tolerate milk products. We are going to talk about that one, how to manage the patient with alpha-gal syndrome. Again, the highest concentration of alpha-gal present in all mammalian meats. Animal viscera, especially kidney, liver, heart, they have a higher concentration of alpha-gal. This is important. When the gelatin from beef and pork that is seen in marshmallow, gummy bears, other gelatin-based items, they have alpha-gal too. And certain butters from lard and tallow, they are often used during cooking. If they have alpha-gal, that can initiate, even though you are cooking vegetables, but if you're using these products to cook, well, you are exposed or sensitized because they have alpha-gal. Other important, cow's milk and cow's milk-based items like butter, cheese, yogurt, cream cheese, and ice cream. Nut milk such as various nut milks available, the almond milk, etc., can or have alpha-gal antigen. So vast majority of the food items do have alpha-gal. So not eating red meat will not preclude that you will never develop alpha-gal. That's the message. Medical products such as MMR vaccine, yellow fever, and zoster vaccine, they do have alpha-gal. Glycerol, magnesium stearate, porcine source heparin, monoclonal antibodies, thrombin, bovine-derived pancreatic enzymes, porcine and bovine heart valves, equine-derived antivenin, and also the personal care products such as lanolin, collagen, and glycerin. They all have alpha-gal. Cow's milk is the only alpha-gal containing ingredient classified as a major food allergen. Some people with alpha-gal may also be sensitive to alpha-gal found in gelatin from beef, pork, in the products made or cooked with mammalian fat like lard, tallow, or suet, meat broth, stock, and gravy. Very important point is not all patients with alpha-gal syndrome have reactions to every product containing alpha-gal. It's amount of exposure to the antigen and how much antibody you have, and did you have an associated alcohol ingestion, non-steroidal anti-inflammatory, and exercise before. All these factors play a role in determining the severity of alpha-gal, or even having symptoms or not having symptoms. So foods that don't contain alpha-gal is very important, especially when you make the diagnosis of alpha-gal. What are the things they can eat? It looks like every other products do have alpha-gal. The poultry such as chicken, turkey, duck, quail, they do not have any alpha-gal. Fish, seafood, eggs, fruits, and vegetables, they do not have alpha-gal. They can be safely consumed. This is the recent article published just a couple of months ago. Clinical presentation outcomes of alpha-gal syndrome. The data is from United States. I want to point out few information from this paper. The paper found the preponderance of female versus male. The symptoms could be urticaria, angioedema, anaphylaxis, and chest pressure, just discomfort. GA symptoms can vary from nausea, vomiting, heartburn, bloating, abdominal cramp, abdominal pain, constipation, diarrhea. Oftentimes, alpha-gal present with GA symptoms with urticaria and other symptoms. But sometimes 10% of the patients will have just only GA symptoms. So you have to be aware. The very important thing is recurrent GA symptoms in relation to consumption of alpha-gal containing products or exposure to alpha-gal containing products. One should think of alpha-gal syndrome. And the other thing is, most of the time, as I explained to you before, there is a lag period from consumption to the development of the symptoms. But 10% of the patients can present in less than 1 hour. So keep that in mind. Most of the studies used serum Ig level more than 0.35. Just stay with me until the last slide. I'll give a algorithm how to approach a patient with alpha-gal and what are the levels we should use. This is a paper from Sri Lanka. It is a little different than what is being published in Western Hemisphere. This particular paper says vast majority of them are children less than 18 years, 66% out of 57, which is different from the cases reported from Western Hemisphere, predominantly adult. The symptomatology, hives alone, anaphylaxis. Anaphylaxis is much significantly higher than what is being reported in the Western Hemisphere. Gastrointestinal symptoms are less when compared to the Western Hemisphere. Abdominal pain alone present in 20% of the patients. The respiratory in half of the patients. Grade 5 anaphylaxis in 1/3 of the patients. The timing is also very interesting. Almost quarter of the patients developed within an hour, and the remaining, of course, there was a lag period. So typically happens after a couple of hours after ingestion. Sometimes it can happen even earlier. This paper shows hives alone seen in 30% of the patients, anaphylaxis seen in 70%. It is highest. In the United States, anaphylaxis do happen, but not 70%. Gastrointestinal symptoms 40% in here, Western Hemisphere, I think around 60%, abdominal pain 30%, respiratory 50%, and grade 5 anaphylaxis is 40% of the patients. So even though it is less reported, looks like it is a fearsome presentation of alpha-gal syndrome in South Asia. So how do you diagnose? Physical examination. Oftentimes they have an associated other symptomatology involving skin, respiratory, and the gastrointestinal. So detailed patient history, the prior consumption of red meat or other products that could cause alpha-gal syndrome. Third is test for antibody that produces alpha-gal, and of course, reach healthcare provider who can deal with this alpha-gal, make a diagnosis and treat appropriately. The current understanding is the alpha-gal Ig level, if it exceeds more than 0.1, is suggestive of alpha-gal syndrome. The specificity of this test at this level is 92.3%, sensitivity is 100%. It covers all of the patients. So the more than 0.35 that's used in other two studies is probably missed some patients. So when to consider serum Ig testing, will you test in all patients? When the nighttime symptoms start with itching, you have itching, nausea, emesis, abdominal pain after midnight. That's one study did after midnight symptoms. They consider doing serum Ig testing. History of tick bites, history of outdoor activities in tick prevalent areas, prolonged irritation at the site of tick bite, and consumes lots of mammalian meats and high-fat dairy products. So these patients needs to be considered for serum Ig testing. Is there a role of skin testing in making the diagnosis of alpha-gal syndrome? They are unreliable and there are lots of false negatives and should not be used to establish alpha-gal syndrome. Sometimes mammalian meat extracts, for example, for beef or beef allergy, for pork and cat allergy can be done, but if they are not alpha-gal syndrome, they are completely different entities. The other test is called oral food challenge. The initial serologic testing does not lead to a clear diagnosis. Oral food challenge may help, but it should be done in a place where they can tackle angioedema or anaphylaxis. It should not be done routinely in primary care office. Even an allergy specialist, they should have epinephrine, ability to take care of airway and blood pressure. All needs to be there before you do a oral food challenge. Most of the time, you do not need. The indications are as follows. The unclear cause of an allergic episode and patient tests positive for alpha-gal more than 0.1, but continue to consume mammalian meat without any symptoms. Those patients, so it does not make any sense because alpha-gal is positive, but he eats without any symptoms. That time, oral food challenge can be done. History of tick bites, significant exposure of the patient is positive for alpha-gal. Advice to avoid mammalian meat based solely on the test results. He did not have any other symptoms. Those patients, oral food challenge can be done. Another group is high alpha-gal level, but tolerate high-fat ice cream made from cow's milk and small amount of pepperoni. Pepperoni is made out of pork without any reactions and no history of tick bites in the last 1 year. Again, oral food challenge can be done before we say, okay, you don't have to worry about eating red meat and other alpha-gal containing products. The fourth, the history of alpha-gal syndrome in patients who test negative for alpha-gal and has been followed over time. So that means when to allow them to eat mammalian meat. The symptoms suggestive of alpha-gal syndrome, but patient tests negative for alpha-gal IgE and additional diagnostics have been inconclusive. In those patients, oral food challenge done. So only there are only 4 reasons to do oral food challenge, but whenever you do it, and make sure you are capable of dealing with anaphylaxis. So anaphylaxis during the oral food challenge. So how do you manage alpha-gal syndrome? There is no cure for alpha-gal syndrome. The primary management strategy is eliminating foods and products that contain alpha-gal for minimum of 30 days. The routine avoidance of cow's milk and cheese are not warranted. But if the patient is still symptomatic despite avoiding mammalian meat, they might benefit from eliminating dairy products. So what are the food items they can consume? Poultry, fish, and seafood. Medical therapies. As I said, there is no cure, only avoidance. But if you're traveling to the tick-borne area and you're positive for serum IgE, fexofenadine, levocetirizine, montelukast can be done prophylactically. When you have predominant GI symptoms, oral cromolyn solution 100 to 200 milligram 2 to 4 times a day, daily, 20 to 30 minutes before meals can reduce abdominal cramps and pain and other symptoms. If the symptoms are refractory, one can use omalizumab or Xolair. The dose is based on the weight and immunoglobulin E levels. Those patients have anaphylaxis on severe symptoms. They should carry self-injectable epinephrine with them. So the self-injectable epinephrine uses only when you have a respiratory compromise, hypotension, and severe angioedema. So how do you approach the patient? When you have a patient with presumed alpha-gal syndrome, meaning patient has abdominal pain, diarrhea, vomiting, nausea, pruritus, hives, or anaphylaxis of unknown cause, with any of the following: resident of recent travel to alpha-gal prevalent regions, recent ingestion of red meat, symptoms occur 2 to 6 hours after eating and at night, and history of tick bite or engaging in outdoor activity. Check the serum IgE level against alpha-gal. If it is more than 0.1, that means positive. If it is less than 0.1, means negative. When the level is more than 0.1, start alpha-gal syndrome management, meaning avoidance of food and products that contain alpha-gal. Avoid tick bites, meaning wear pants and permethrin-treated attire when hiking. Check for ticks and shower after hiking. If a tick is found, remove it immediately. If the symptoms not relieved, consider alternate diagnosis. You have the symptoms, but the test is negative, look for alternative diagnosis. Consider testing for beef, pork, and lamb. Consider oral food challenge, and consider consulting allergist for alternate causes of anaphylaxis. If the symptoms are relieved after the avoidance, continue alpha-gal syndrome management, continue avoidance of the food, consider oral food challenge in those specific indications, recheck alpha-gal IgE 6 to 12 months later, prescribe antihistamines for all patients, allergist referral with injectable epinephrine for those with severe symptoms concerning for anaphylaxis. Avoid non-steroid anti-inflammatory drugs, alcohol, and excessive exercise. How to live with alpha-gal syndrome? It is a chronic disease, as you can see. It should be managed under the care of an allergist or other healthcare provider who knows and how to treat patients with alpha-gal syndrome. Recommend patients with alpha-gal syndrome stop eating meat from mammals, such as beef, pork, lamb, Venetian, or rabbit. It's very important to remember, not all patients with alpha-gal syndrome have reactions to every ingredient containing alpha-gal. How to prevent? Prevent tick bites. It reduces your chances of developing alpha-gal syndrome. Before you go outdoors, avoid grassy, brushy, and wooded areas where ticks may be found. Walk in the center of the trails. Treat clothing and gear with permethrin or buy pre-treated items. Use EPA registered insect repellent because some of the insect repellents themselves are harmful. After you come back from indoors, check your clothing for ticks. Examine gear and pets for ticks because pets can carry ticks to your house. Then they bite you later. Most of the tick bites are painless. That makes it harder. Shower and perform thorough tick check when you come back indoors. When to refer the patient to an allergist? When patient have symptoms such as facial or throat swelling, voice changes, breathing difficulties, hives, or fainting after eating. So these are all indication for allergy specialists. Number one, you need to aware there is a condition called alpha-gal and do a test. And if there are symptoms are severe, immediately send the patient to allergist or emergency department, urgent care, depending upon the severity of the symptoms. What kind of advice you give to the alpha-gal syndrome patients? Number one, prevent future tick bites. Most patients, that means 89% of the patients who avoid tick bites tend to see a decline in their alpha-gal Ig levels. 12% of the patients tracked for more than 5 years have negative alpha-gal Ig titers come down below 0.1. Then able to reintroduce mammalian meat into their diets. If the patient is still consuming red meat, they should be advised not to use alcohol, non-steroidal anti-inflammatory drug, and also other fatty meats. The fat portion of the meat has more alpha-gal because it's glycolipid. Educate these patients potential risk of accidental exposure to alpha-gal through processed foods, restaurant meals, and inhalation of aerolized alpha-gal from cooking bacon and beef products. So those are all they need to be aware of that one so that they can avoid. Anaphylaxis may need urgent care. They may not have an allergic reaction after every alpha-gal exposure. That's very important. People should not feel like, well, I already ate, I do not have any symptoms, so I am free from alpha-gal syndrome. May not be the case. This picture shows how the progression of alpha-gal syndrome happens. The Lone Star tick lives in this part of United States. The carrier is deers. The tick bite causes local erythematous, and most of the time, sometimes it's painless and goes unnoticed. It takes about 1 to 3 months for the IgE antibody to develop against alpha-gal. Then when you can consume mammalian products, 2 to 6 hours later, you develop urticaria, angioedema, anaphylaxis, GA symptoms, etc. This this picture came published in a few months ago. I really liked it. You may not be the hunter, but you may be a jogger in the wooded areas where you can get bit by ticks. Sometimes the ticks can be in the domestic animals like cats and dogs at your house. They can introduce alpha-gal. It takes a week or months to cause sensitizations. As I mentioned the earlier, this 1 to 3 months. When you expose mammalian meat or other alpha-gal containing products, the GA symptoms and other allergic symptoms develops after most of the time, 90% of the time, after an hour. Then when you suspect, check serum IgE level for alpha-gal. That clinches the diagnosis. This concludes the talk on alpha-gal syndrome.